Hello and welcome to the Superintendent's Perspective. I am Mario Salinas, Superintendent. I am joined by our Board President, Miguel Mike Farias, and COVID-19 Director, Dr. Anthony Garza. Today's topic is COVID-19 update. Dr. Garza, as COVID-19 Director, you may be the only COVID-19 Director that works for a school district in the whole state of Texas. I am not aware of any district that has a COVID-19 Director. Can you tell us what is it that you do? What as a COVID-19 director, what do you do for the school district?
Well, Dr. Salinas, thank you for having me on your show, Superintendent's Perspective. And I was formerly the high school area director, and I thought I was pretty busy. But 3 weeks later, it has been the busiest 3 weeks I've had in several years. My main job is overseeing the prevention, mitigation, and response to COVID-19. So what do we mean by that? The prevention is the vaccination effort, and we'll talk about that in a little bit. The mitigation is the COVID testing and the safety protocols that we have in our schools. And the response is, what do we do when we find a positive COVID-19 case on the campus? So those are my three main areas in this job as COVID-19 director.
Excellent. And so what was your idea when you first got approached with taking this position? I mean, I'm just curious. I mean, it's uncharted waters, to put it in a better perspective. But what was your first thought when you got approached with this?
I've been in this business for 26 years, 8 of those as a teacher and 18 of those as an administrator. And when you become an administrator, you're here to serve in any capacity. And when Dr. Salinas approached me and told me the importance of this job and the history, how historical it's going to be on the front lines against COVID-19, I was honored. I was humbled, and I was honored to take on the responsibility to fight the spread of COVID-19 in our community. So it's been an experience these 3 weeks, and I'm looking forward to seeing it through to the end.
And, you know, I mean, as far as my point of view, I've been to, if not all, at least the 3 of the 4, now the 4 out of the 5 distributions that we've had. And I always see it get a little bit better. You know, you tweak here, you know, your first one's always your first experience, and you learn and you learn. And what has been your experience with the distribution of the vaccines? I mean, can you share a little bit with the public what your experience has been with that, and really the satisfaction you get when people are walking out with that smile on their face saying, we're finally vaccinated?
Well, we host our vaccine clinics at Vela High School.
Yes, sir.
It's a big operation. It involves about 180 employees, with the majority of those being Edinburgh CISD employees, and 30 of them from the city and the county. But we line up at the stadium. We have a lot of police officers out there lining up at the stadium. They come through the parking lot. They park at Vela High School. They wait in their cars. We coordinate 50 people at a time. They come inside. After that, we've got a lot of paraprofessional staff that registers them and make sure that their paperwork is filled out. They go to a holding area where we have custodians and administrators. Vela High School has really done a lot for this. You know, Michelle Pena, we owe her a lot of thanks, the principal of Vela High School. We've borrowed 3 assistant principals, 15 custodians, you name it, several of their secretaries, and they're very helpful. One of their counselors as well. But they come out there and they know it's for a good cause. They're not saying, I need to go back to my job already. They're there. How do you need me to help, Dr. Garza? And we have them there, and they have so much customer service going on. It's great to see. I really enjoy seeing how they're treating the community, because these are not all, this is community members. We don't know all these people. And we bring in 1,000 people every time. We just finished our 6th clinic yesterday, Thursday, March 11th. We just finished our 6th clinic, 1,000 doses each time. That's 6,000 doses, along with our first 100 doses of Johnson & Johnson. That's the first single dose vaccine. It's a great feeling when the community member that's been vaccinated is walking out and they tell you, hey, you there in the blue jacket, thank you so much. This was very organized.
Yep.
And it wasn't like that at the very first clinic, but by the fourth and fifth clinic, we've tweaked it and we've made it as efficient as possible.
And, I just want to point out something that's very important is, sometimes people think, wow, you're using a high school, are you interrupting the class, are you interrupting the studies, and just so everybody could know, at Vela, I believe a school that usually has 2,000 plus kids, we have under 200 coming face to face right now. So we're not interrupting anything. As a matter of fact, this is the prime time to do it. We have the facilities available, and we're taking advantage of that time and being good stewards with using these facilities to vaccinate our community.
Yes, sir. You mentioned this at the last show that we did. Our organization, our school district is 100% taxpayer supported.
Yes, sir.
Without our community paying taxes, I wouldn't have a job. Dr. Garza wouldn't have a job. We wouldn't have the facility. Everything we do is because of the taxpayer.
Yes, sir.
Our salaries, the facilities, the gyms, the beautiful facilities that we have, the huge parking lots, the police force, 100% of our operation is taxpayer supported. That we feel, and you feel the same way, that we need to give back to our community in light of the fact that a good majority of our students are quarantined at home.
Yes.
And so that allows us to free up some of our employees, for example, the police.
Yes.
That we have a 100 force police department, and they exist to take care of our students and our staff, to make sure they're safe. And with less students on campus, that frees that force to help us with the traffic.
Yes, sir.
And then we have the staff, Mr. Garza, myself, all of us. It frees us up a little bit more to concentrate and try in our effort to get back to normal, to get the students back on campus. You mentioned Robert Vela has about 200 students on campus from out of 2,000.
Yes.
That the goal of these clinics is to get more students back on campus. As you know, we vaccinated all our staff. We think that is a big step forward in getting back to normal. And now, with Johnson & Johnson, we vaccinated this week students. We're beginning to vaccinate students.
Excellent.
That fit the category. And now we vaccinated parents, also
Good.
some of our parents. So we have requested 2,000 vaccines from Johnson & Johnson. Hopefully we'll get positive news and get good numbers so that we can start inoculating our parents so that we can get back to normal and eventually more students. I'm of the belief that our campuses are safe, Dr. Garza, for the parents. What message do you have for the parents as far as how safe are the campuses for students to come back?
Well, every campus has a work safe plan, as was mandated by the city of Edinburgh last year. And we took that a step further. It's not just a school district plan, but it's an individual plan per campus, because each campus is built differently, and they have different hallways and different entrances and different parking lots. And they all have a plan where they enter through this door, they get a temperature check, they wear the wristband when they know that they're not running a fever. They do a self-screening form. So there's a lot of safety protocols. There's directional arrows in hallways where this hallway is only one way so that we don't have a lot of cluster of students in it. We have a lot of these plexiglass around the school district, in front of the teachers, in front of the principal, in front of counselors. So we've taken a lot of safety measures to ensure that the campus is safe for the children. And you're right, I'm going to reiterate, we have less than 200 students going to Vela High School right now. And that gives us the opportunity to run these clinics. And it is taxpayer money at work here. We owe it to the community to have these vaccine clinics for all of our community members.
Yes, sir. Yes, sir. And it's been very encouraging, and I'm looking forward not only do we see the light at the end of the tunnel, it's getting a little closer. And every day that passes, and it's a combined effort. I mean, you got everybody from DHR to the county to Walgreens to Region 1 to UTRGV participating in this. And if we all do our part, we'll get to that end of the line a lot quicker. And I feel that we're just doing our part with the with the manpower that we have and the facilities that we have and the resources and the infrastructure that we have, to use it wisely to help out the community. Because whether your child comes to Edinburgh school districts or not, if you live in Edinburgh, you're paying taxes. So basically, I know when I was out and about and people would say, well, I'm not really concerned about who sits on the board because I don't have any kids in the district. I said, yeah, but your money goes to the district. And then they would think, whoa, you're right. I said, over 50% of your total taxes go to us. So you should have some interest of what happens in Edinburgh, because that's a big chunk of money. And I feel that we're using our resources wisely and effectively, giving back to the community that invests so much in us.
Yes, and not only there's some in the community that have a false pretense that I don't have a house, I don't pay taxes. Yes, you do. When you fill up your gas, your car with gas,
yes,
there's a big tax, and a lot of that tax comes back to the public schools. When you buy groceries in Texas, there's taxes, and some of those taxes come back to the school district. So everybody pays taxes.
And, I'm glad you pointed out, even if you're renting, I said, I'm renting, I'm not paying taxes. Right. Well, the landlord raises your rent according to his taxes. Yeah. So eventually it does come out of your pocket. Either way you slice it, everybody's paying into it. So that's why I'm so excited that we're willing to give back, not only to just our staff, our students, but our community.
Sir, we've been almost a year dealing with this COVID-19 pandemic. You have lost people to the COVID-19 to death.
Yes.
People that are close to you. I have lost people close to me, and Anthony, Dr. Garza, you as well. All of us, or probably anybody out there knows somebody that passed away because of COVID. And you're right. Every day that goes by, things look better. The situation looks better. The hospital rates are going down. The positivity rate, the spread of the disease in the community is going down. The level of deaths are going down. All the metrics are worldwide, national, state, and local are in decline, it appears. So the light is getting bigger. I am excited. I am really excited. I am anxious to get back out to the school and interact with students.
Yes, sir.
I look forward to the day where I can walk into the classroom and talk to students.
A full class.
A full class, a full class, right?
A full class.
Not 7 or 8, right? And I look forward to the day where the students are happy to interact with their friends and with their teachers and with visitors. And I am looking forward to the day. Things are looking good. As every single day, things are looking better and better and better, it appears.
Good.
Dr. Salinas, another initiative that we've taken is the COVID-19 testing program for ECISD. Based on guidance from TEA and the Texas Division of Emergency Management, they recommend testing every 2 weeks for regions that have a hospitalization rate between 7 to 15%. And currently, Hidalgo County hospitalization rate is at about 12.5% for the last 2 weeks or so. So we fall in that category, and we've initiated a COVID testing program where we're asking our employees to voluntarily test every 2 weeks. And we're hoping, again, this is another mitigation effort that if we have a positive case, we send them home.
And Dr. Garza, how many of these tests have we given out? Do you have a number? I know we ordered a bunch of them,
Well, we have 5,000 employees, and we're trying to get them done every 2 weeks. So
Wow.
we've done over 10,000 tests.
No, we've done more than that. We've received 35,000 test kits.
Nice.
And we first we received 24,000, and then we reordered another 15,000. So we're probably getting up to 30,000 tests that we've.
So this is above and beyond the administration of the vaccine. These are tests. So so we're even involved in that. And in order for us to secure that we can bring in somebody clear of the virus, we're taking all these preventive steps to make sure that we have the cleanest environment possible for our children to come to school to. That's good.
Correct. And then, when we give these tests, the elementary schools have less employees, but, they do about 50 employees. The middle schools, roughly 200 employees, and then the high schools are 300 employees. So for some of them, it takes them 2 or 3 days to get everyone tested that wants to be tested. And we're finding that the majority are still, hey, you know what, I want to get tested just to have peace of mind that I'm not going to infect others if I am asymptomatic or have minor symptoms, and I'm okay. I think I'm okay.
And the beautiful thing about 100% of our employees that wanted to be vaccinated are vaccinated. That would cut back on the testing that we're going to do on those individuals, because once they get their second dosage, the probability of getting the virus is minuscule to none, which is a great advantage. And that's what I mean by the light of the end of the tunnel is getting brighter. And every day we're getting a little bit closer.
Absolutely. The time when our staff get the second vaccine, you're right, the likelihood of them getting infected is not high. And if they do get infected, all the research says the infection is going to be very mild, like a cold, like a common cold, maybe a common cold. Dr. Garza, describing typical, for the parents out there, describing typical campus. When the child gets to the campus, tell us about the campus and how it's safe.
Well, all the students,
when they get dropped off, they do the temperature check, they get the bath, and then they're off into the classroom.
All of the students get temperature checked upon arrival to the school. If they ride the bus driver does a temperature. But if they get dropped off, one of the staff members does a temperature check. And if there's no fever and they don't have any symptoms, they go straight in. They have to wear their masks. They have to stay 6 feet apart. They pick up their food and they eat it in the classroom, the breakfast. And they all have a carrel like this one between them. And they're sitting 6 feet apart. Our numbers right now are low. That they're not big numbers because parents still have parent choice. But the schools are safe. We're finding that whatever positive cases that we find, they're coming from the home. They're not coming from our schools. 99% of all the positive cases we've had have been from home. So, when you think about when you go to the businesses or the grocery store, there's nobody temperature checking there. Nobody's wiping behind you when you touch a can of soup or vegetables or produce. But at the schools, they are. When you get up, they wipe the chair. When you leave, they wipe the carrel. When you walk out, they wipe your desk. So we've taken a lot of safety measures and spent a lot of money on cleaning supplies to get this done. So I know they're starting to eat in the cafeterias as well, lunch. But they're very spaced out. There's 2 people per table on opposite sides of the table, right? The students at the elementary, they sit about every 4 chairs facing in one direction. And they can't talk to each other. They wave from far away, and they can take their mask off and eat. And the few that have grown and have more kids than they were able to initially handle safely spread apart like that, they've put these clear carrels in between them, and they're eating with their friend like this. And so they're not spreading any infections or anything because we've taken those precautions. So the schools are very safe right now. And my son started going to school when the teachers came back on March 1st. He's a senior this year, and I know that we talk about last year's seniors. Oh, it's so sad that in March the pandemic hit, and for April and May, these poor kids didn't go to school those last 2.5 months. Well, this year's seniors, they haven't gone all year. The majority of them have been home.
Yes.
So I know I told my son, hey, when the teachers go back, you're going back, son. So I'm excited. He's finally combing his hair again and cleaning up and getting back to school. And I can see a difference in him because he's back face to face with the teacher. So I recommend all the kids, when they get a chance and they're feeling more comfortable and the vaccines, all the teachers are vaccinated, that they come out to the schools again.
Well, Dr. Salinas, you have children in the district, and they're back.
Let me say this about my own son. He's a seventh grader, and he was at home and quarantined at home in a small room on a computer, talking with the teacher the whole day with a small break. So he said, "Dad, I want to go back to school." And I told him, this was several weeks back, and I told him, "Well, Mario, it's going to be the same as being home. I mean, you're going to be looking at a computer all day and basically the same." So, but he wanted to try. So we tried that. And he didn't like it. I said, "Oh, Dad, it's the same thing. It's like being at home." So I said, "Okay." So we did it for a week, and I took him back home. But now with teachers back on campus, it's different. He goes in there and he can ask questions. So I was telling him this week that now with the teachers back on campus, you're going back, and he's excited because he wants to interact with the teachers.
That's good.
He wants to be able to, if he doesn't understand a certain math question, Daddy's not going to be able to help him. He's already gone past me. He can raise his hand, and teacher can help. That wasn't happening.
Yeah.
The teacher can actually help my son or the students there. They have a question, he raise hand, and they can answer the question. It's like being in class, face to face. And then bell rings, he goes to the next teacher, and he's there with his friends that are in his classes, and they're interacting with the teachers. They've got these carols and they've got the mass, but they're talking with each other. Mm-hmm. To me, that is as close to being to normal as we've been in almost a year. So I'm excited for all children, and I encourage parents to consider sending their children to the campuses. They're safe. They're safe. I feel safe at work. I feel our campuses are safe, and our teachers, now that they've been there, now going on 2 weeks, they themselves are realizing, hey, this is safe. That's what I hear.
Yes, sir.
When I'm out there, the teachers are coming up to me and say, "Man, this is safe. I feel really comfortable." And so, yes, so the parents out there in the community, our schools are open, our teachers are back, and our schools are safe. So send your children and give it a shot and see how it turns out for you.
And let me just add, Dr. Salinas, that before the teachers returned to campus, when they were still teaching from home, had the option, the students that were coming in had to sit in front of a computer the whole day. Just like you said, they were there in front being watched by a teacher aide or a substitute. But now, since March 1st, at the middle and high schools, they're rotating with their schedule, with their 8 periods throughout the day. And I've gotten feedback from some teachers saying that their 7th period student is saying, like, "Wow, this is so awesome that I finally get to see all my teachers. I've been coming for months, but I'm sitting there in front of a computer screen all day, and now it's so neat to get to go to my elective class and to go to my career and technical education class on the bus at the Career Center and all these things."
And the teachers are seeing their children for the first time.
Yeah.
For the first time, they haven't seen these kids at all. Now they're seeing them.
That's true, because this is the first time they actually get to see them since the school year started.
Yes. So
That's true.
It's good all around. It's a great thing for us, I think.
Excellent. Well, is there any other subjects that
the one thing that we cannot forget, and I'm going to let Dr. Garza talk about it, our partners that are helping us
Oh, yes.
with this effort.
The vaccination of all of our employees that wanted one, we keep talking about that, and it's approximately 4,300. Could not have happened with us alone.
And counting.
We have partnered up with Hidalgo County Precinct 4, with the Hidalgo County Health Department, with the City of Edinburgh. I know the mayor and the city manager have contacted us, and they kind of got it started with the whole thing. They sent out the original wristbands, back in January. DHR Health, we've reached out to them, and I know you yourself have reached out to them. Dr. Salinas, now in my 3 weeks, now I reach out to them, and they've come through with our employees, helping us get our schools safe again. And then now Region 1 as
Yes.
well. Region 1 is endorsing us with Commissioner Mike Morath to give us more vaccines, because we've had a lot of feedback from people that go see our clinic. We've had other districts come in with their notepad and taking notes and
Yes.
show me where the holding area is and how many
Yes.
officers are there and the cones and who wipes after every person gets up and moves along, how many nurses are getting vaccines, and they take their notes back, and then they run a pretty good clinic where they're
That's
coming
good.
from.
That's good.
And even the county employees have said, hey, we need to take this model and take it to other places. So that's one of the things that we're seeing, that our partners, if we didn't have these partners, we wouldn't have been able to accomplish the things we have with our vaccination clinics. I did want to finish with talking a little bit about Johnson & Johnson vaccine. We mentioned it earlier. Up to this point, we have been using the Moderna vaccine, which is a 2-dose vaccine. You get the first dose, and then 1 month later, exactly 4 weeks later, we administer the second dose. With DHR, the wristbands they've given us has been Pfizer, because that one has to be extra cold, and we don't have the freezers with the county, but they do, and we've gone over there. We've had employees go over there. But now we have Johnson & Johnson, and that one is going to be ours and ours alone as far as the school district. And we'll be able to service our community members with a single-dose vaccine.
Yeah.
And we just got our first 100. We opened the package 2 days ago, I believe, and we're getting phone calls. Hey, when do you get that Johnson & Johnson? We only had 100, and we've done 100 right now, but we're anticipating 1,000 or 2,000 in the next few weeks. And stay tuned to our ECISD and Twitter social media pages for our press releases, because we have to give short notice, and we apologize for that, but we give you about a 2-hour notice. So you need to be checking our social media page, because if we give you a 24-hour notice or a 3-day notice, we'll have tents set up in the middle of town waiting for those vaccines, and that's a safety problem for us. So we are giving about a 2-hour notice for our wristband distributions. We're going to continue with Moderna, but now we are going to be adding Johnson & Johnson. And it's going to be a big game changer for our community.
That's good.
And the reason, sir, that we opt to go the route of giving a notice and that we're going to be distributing bands at the stadium is because if we go the route of where the community needs to register online, Edinburgh covers 1,000 square miles of territory. We're one of the biggest school districts in terms of square miles in the whole United States of America. A lot of our parents, a lot of people that live in our district, they're rural. Internet connections are spotty at best, or no connection at all. Those people would never get bans.
Yeah.
So we will go the direction of, look, we are giving out bans. Everybody listens to the radio, and everybody sees the television and has phones, and we think that if we go that route, everybody has a chance to get the bans, not just those that have internet connections.
And one thing that I wanted to point out, we were this past Monday at DHR, and they celebrated their 100,000th vaccination. That's just DHR. That doesn't include what the county has done. So combined, down here in South Texas, we're really administrating these vaccines at high numbers. So we'll get there sooner than later. We just need to get there efficiently and effectively. And we always encourage individuals, if you take your first vaccine, you got to take your second one for the best coverage and the best protection. So we just encourage somebody, if you do take the first one, make plans, make it a priority to get your second one. That way it's effective. And then also I just wanted to add that we've also partnered out with Walgreens. We partnered out with Walgreens, and we're getting different phone calls from different individuals because we have the vehicle to administer the vaccine effectively. So that's a big testament of working together and making it priority number one back in December. And obviously the fruits of our labor are there. Good thing.
I wanted to add one final comment was on Governor Greg Abbott's executive order that he issued last week. He removed the mask mandate for the state of Texas effective March 10th. And we want to make sure that the parents know that the school district falls under the Texas Education Agency. And TEA has told us that we can maintain the exact same protocols that we had before this executive order, and only the school board can change our rules. So for right now, we continue wearing masks.
Yes.
We continue our safety protocols, and we continue our social distancing and campus work safe plans.
I'm glad you pointed that out, because we're going to take every precaution necessary to keep everybody safe at ECISD. Okay.
Thank you for joining us for the Superintendent's Perspective. Stay safe and stay healthy.